Afternoon. Can get a confirmed time. All right. How are you today? We're excited for you to all the episode of the year before being up. So do I get intuition? I will be rating this today. Now, very that we share with you today. The medical doctor is not able to join some technicality, but that irrespective, we will have a very wonderful time. The topic is quite main humanism. Yes, it's on children, but again, we must understand this all children. We begin to know that the some parents will and we do not very we must also begin to that the cause of this behavior disorder. Well, the interactions of what we do really later to get individual and young have been disorder. Have two wonderful individuals here to know us the and the expertise to have. There is the Oluwatimi Chikemela consulting secretary, the child recent service of Federal Neuropsychiatric Hospital. She managed children and attained neurodivergent disorders, autism spectrum deficit, hyperactivity disorder, intellectual disability, learning disorder, developmental, various emotion and behavior disorder. Dr. Ashike Melo studied and saw at the University of London at the resident at the Federal Canada, doubles a public health at master degree in public University, Nigeria. She passionate about recent change, preaching the gospel of men all over the world with the hate, shells and eyes in the conversations and mental ability in the community. She reached a constant psychiatrist and she's with children. There is no one to take this person. So welcome. Now the second is who are full. She's a dedicated integrated psychologist. It's a year experience supporting adult and young individual facing challenges such as anxiety, depression, other mental health concerns. She holds a bachelor and a master in clinical psychology from the University of Leeds. Being former education, Ms. Hicks has and attended various sectors work and experiences for mental health. Attachment to personal development further demonstrated by membership in esteemed organizations, including Nigeria Association, the Nigerian National Clinical Psychologists, the International Society Institutionals, the Employment Center National Board. Currently, as a psychologist, the Federal Medical makes deep passionate about purpose to wise in the world of the future generation. I want to watch and apply effort in efforts of life. And will tell you that the professionals today, wow, improve and help to live better, do well, and ensure regard that generation. So, again, understanding the all the issue, what are the and interventions that are to this conversation today. Please, if they that you know here, teachers, parents, caregivers, pastors, people and do words, then please meet them. It's time for important very important question because not that is this situation ensuring that the sector of our to allow that they will have this conversation for us. Tell about disorders in children and how different from our childhood. Dr. La.
Okay, good afternoon, everyone. Can you hear me? Can you see me? Am I audible?
Hear you.
Okay, all right. Thank you very much for this opportunity to speak at this Yaba Voice webinar. And I particularly love this topic because we are currently in the age where a lot of parents are seeing a lot of behavior in their children, and we are also battling with the digital age where a lot of children have a lot of exposure to different things. So talking about behavioral disorders in children. And I would like to start by saying that behavioral disorders in children refers to when there is a continuous pattern of some set of behavior in children, which can range from emotional, such as the way they express how they feel, and also in terms of behavior, that is doing what is expected versus what is not expected. When they have these difficulties, that significantly interferes with the child's functioning, either at home, in the school, or even in the social environment. So, for example, you may have a child who may exhibit some form of aggression, maybe insulting, abusive, which we tag under verbal aggression, or even being physically aggressive, such as maybe throwing things at other people, destroying other people's things. And we could also look at some examples in which a child defies rules, mean the child is not able to follow rules and regulations that is expected. We can have a child that is just very impulsive. The child does whatever comes to the child's mind without thinking, is this what I'm supposed to do in this context or not? Hyperactivity, also a very common example of behavioral disorders in children. You see a child who is not able to sit still, who is always on the move. In child and adolescent psychiatry, we say they are acting as if they are driven by a motor. And then we could also see cases of emotional outbursts. A child can just burst into various forms of emotions, either anger, irritability, and they could also have problems following age-appropriate rules. Now, it's important to remember that children, the typically developing children, can display unpleasant behaviors occasionally. We label these ones as tantrums. We say a child is throwing tantrums. We say a child is being stubborn. And then, when a child has some a child is also allowed to express their emotions. A typical developing child is allowed to express his or her emotions. When they are sad, when they are angry, they are allowed to express. And this is all part of normal. But by the time these difficulties now become continuous, it is severity, the frequency, and how it affects the life of the child that now makes us as a behavioral disorder. Thank you.
All right, thank you so much, Dr. Alala. She had given a different. What are some that you may like this as well? Okay, nation destroying terms and actually in would call out this. Now, Miss X talk to all about some of the early warnings the teacher give watch out and children's houses to you, Miss.
Good everyone. My name is Oluwatobi X. I'd like to appreciate the medical director for this opportunity and also appreciate Yaba Voice. Some early signs that parents should watch out for. Well, first of all, they need to understand that when it comes to behavioral disorders in children, these are things that really happen suddenly. And then in most cases, these are patterns that become persistent over time, and it begins to affect the child's functioning at home, in school, and socially. So some of these important warning signs include the following. One, like difficulty following simple instruction consistently despite repeated guidance. So for example, now a teacher tells a child, sit down and open your book. This is something that is said every single morning. But you realize that the child is easily distracted by things in the classroom, talking to other people, and act like, oh, I'm just hearing this for the first time. I'm just saying this, and you observe that this does not just happen at once, but every day. And so, despite reminders and consequences, another one is repetitive lying, stealing, and rule breaking behaviors. So this is not the occasional type of lie. This lie happens every day, even when the truth would cause no consequences. So you observe that they start stealing little things, maybe sharpener, erasers from schools and all. That is why it is important for parents to actually check their children's school bag, before and after they return from school. So also they begin to break rules. This same child begins to break rules over and over again, and then seemingly without connecting their actions to their outcomes. So you observe that these patterns are persistent and they are not just situational. So another point is sudden decline in academic performance or school refusal. You realize that a child who previously enjoyed school, having good grades and all, you realize that all of a sudden they start failing. But what you see is that they start faking sickness every morning to avoid going to school, or they get to the school gate and they are crying. A normal Nigerian woman will start beating a normal Nigerian parent to start beating the child. Why are you doing this? Why are you that? Because they don't really understand. But when you observe closely, you understand, you see that maybe the child has been bullied or is struggling with anxiety or dealing with something very difficult at home. Or it might even be that the work has increasingly become hard for them to process. But because the behavior looks like laziness or deviance or on the surface, the real cause are missed. So another point we also need to another warning signs parents need to watch out for is repetitive deviance towards authority figures beyond normal development behavior. So every instruction from parents or teachers becomes a battle. Brush your teeth, and they are there for 30 minutes without doing anything. And it's time to leave. They start screaming. This same child starts to scream, and then they refuse to do what their parent or teacher have instructed them to do. So this is not a child going through a phase. This is a child who is consistently opposition in a way that disrupts the entire behavior. Another point is poor emotional regulation. So, for example, a child starts crying uncontrollably after going to the store to pick one or two things, and because you already explained to the child that okay, no snacks for you today, you get that tomorrow, and all of a sudden you see the child rolling on the floor, seeking attention, behaving, in an unhealthy manner that is so embarrassing. So when you look at that behavior, you can say that the intensity of that reaction is beyond the situation itself, and this reflects difficulty in regulating emotional appropriately. So one thing I usually emphasize on is this: a child can occasionally misbehave, which is normal in development. But when the behavior becomes persistent and disruptive across board, then it deserves professional attention. Thank you.
Thank you so very much, Miss X, for that. Now, apologies to those who seems to be hearing it cracked. I don't know, maybe it's the network from my end, our end, or your end, but we'll try and most as possible to manage things. We'll have tried to change my device to ensure that we have a very seamless interaction today. And she had told us some of the warning signs that we can see. Now, some of these signs are related in some ways to some childhood issues or behavioral patterns that children sometimes would bring up. But again, what we are saying is it's persistent, it's destructive, and it affects the functioning of even the child itself and very many other children around them. And that's what Ms. X has told us and that we should watch out for. Now, Dr. Lanade will be taking us through what are the common causes or contributing factors to behavioral disorders in children. I want you to pay quite a lot of attention to these because there are things sometimes that we tend to overlook. But she's going to expound to us so very much the things that actually would cause or contribute to the development of the childhood behavioral disorder. Over to you, Dr. Alalade.
Thank you very much, Dr. Kemi. So when we talk about the causes of behavioral disorders in children, it's important to know that one single cause is not what we attribute to behavioral disorders. Rather, we talk about a combination of factors. So I would like to break these factors into the biological and the psychosocial factors. So what do I mean by biological factors? For biological factors, I'm talking about the innate of the child. What is the build-up of the child? So for children that already have some diagnosis such as autism spectrum disorder, attention deficit hyperactivity disorder, some children who have learning difficulties, and some even have difficult temperament. So, for every child, as a child is developing in the early developmental years, we are usually able to group children into either having an easy temperament, a difficult temperament, or is mixed. A child with an easy temperament is a child that we are saying that when the child is crying, and you pet the child responds easily, the child is free going, relates well with both caregivers and strangers. And a child with difficult temperament will do the opposite. It takes a while before the child is parted to stop crying. So when a child has this development of having a difficult temperament, those are some of the things that describes the biology of a child that could experience behavioral disorders. And in terms of the psychosocial, I'm talking about the environment, because all of these things, apart from the nature of the child, the environment of the child also plays a high role in the presence of these behavioral disorders. We start with family conflicts. A lot of times, what happens in the family determines what the children learn. Children learn by modeling. So when there is family conflict, the children are either learning what they are seeing, or they are repeating what they are seeing, or they are expressing how difficult it is for them to witness those family conflicts. Inconsistent parenting. A child who has experienced abuse, a child who has experienced neglect, some of these can make a child to develop behavioral disorders. When there is an unstable home, a child who is witnessing domestic violence. I once had to assess a child, a 7-year-old male, who had witnessed recurrent domestic violence of the mother from the father. So by the time we started assessment and we were doing play-based intervention for this child, the first thing I realized was that every time this child enters the assessment room and sees a female doll, what it starts doing is it starts eating that female doll severely. And that's because that is what he has been used to, seeing a man eating a woman, because that is what he has seen his father do over and over. So some children that also have academic stress, they could have some of these behavioral disorders. If they are not coping well in school, they don't understand what is going on. Parents don't understand what is going on. Just like Ms. X had mentioned, by the time we start seeing some of these things, they are already warning signs that this behavioral disorder wants to come up. So academic stress too is some of the things that could be a cause. So in summary, what we are saying is that when a child is having behavioral disorder, it is a reflection of the internal emotional states of the child in relation to the environment that the child is in. It is the interplay of these factors that predisposes a child to having behavioral disorders. Thank you.
So what Dr. Alalade, thank you so very much, is children learn by modeling. And there's something you just said now, the interplay. There is a combination of a whole lot of things going on, and we must be mindful of that interplay for us to be able to ensure that we nurture in the right environment. Now, Ms. X is going to talk to us now about how can parents maintain consistency in discipline without being harsh. I know that for the African parent, you want to ensure that you pass discipline but some of them have also been said to be very harsh, which could also be one of the cause or one of the causes now. Ms. X, how can we maintain consistency in discipline without necessarily being harsh as parent? Thank you. Over to you, ma'am.
Thank you very much, Dr. Kevin. So when it comes to maintaining consistency in discipline without becoming harsh, first of all, parents need to understand that children are dynamic. And so in order for this consistency to take place, they don't need to become aggressive before discipline becomes really effective. Why? Because children respond better when expectations, routines, and consequences are clear and stable. Now, because there's a challenge already, there must be a repetition of what they need to do and what they don't need to do over time. So one of the practical ways parents can maintain for this is that they need to set clear and age appropriate rules. Now, rules should be age appropriate. So for example, for a 5-year-old, you're not saying instead of saying be good, you know, which sounds too vague. You say it you say it by using your words. Make your words clear by saying, okay, we don't bite. Don't bite. Don't just say be good. The child doesn't really understand what you mean by be good. Then for a 10-year-old, you set clear rules as well. And clear rules sounds like homework should be done before screen time. So with this, the child know exactly what is expected, even before they are being punished or breaking it. So another one is giving instructions calmly and directly. So instead of saying, how many times have I told you to tidy your room? You walk up to the child, you try as much as possible to maintain eye contact, and then you speak calmly. Please pick up your toys and put them in the box before dinner. So one instruction, calm voice, and clear expectations. So the child tends to respond appropriately to what you have instructed them to do. Now, follow another one is you have to follow through with their consequences consistently. So, if a child refuses to do their homework, you need to make them understand that no homework, no screen time after dinner. So if the child refuses to do homework, you need to insist that there is no screen time. And you have to be polite about it. You don't need to be angry and act like, no, they have done something very terrible. You have to speak with them calmly and you have to keep repeating it. So because the child choose not to do the homework and insist that he or she will watch the TV, he or she will watch the TV, then you don't have to put on the TV for them to watch it. So another one is focus more on correcting than attacking the child's behavior. So this is very significant between you are lazy and not responsible than saying that leave your bag in the middle of the floor is not acceptable. So the one sounds like attack to the child and the other sounds like they are being corrected. So also reinforce positive behavior immediately. So the moment you see a behavior you want, you have to praise them. So for example, you can tell a child, oh, I can see that you shared your snacks with your brother. That's very kind of you. You don't wait for the next day before you appreciate their behavior. Thank you.
All right, thank you, Ms. X Oluwatobi. And what I hear from her is consistency. Consistency is key. Consistency is important in terms of maintaining clear expectations. What do you want from them? It must be clear. You must also be able to understand that you are correcting the situation. You are not attacking the person. The moment you start attacking, it becomes a problem, and it's going to be difficult for the child to understand and relate to what it is exactly that you want to communicate with them. Again, she mentioned the fact that there should be consequences. And so when it's not done, oh, you are able to take something away from them, which is consequential and which would help you to reinforce the behavior. But the thing that she now said that I paused when she mentioned it was when she now said, speak calmly. And I'm thinking in my mind, do they hear calm voice? Because I have somebody in my house who, the moment you speak calmly, he looks at you and he says, I have heard, but he doesn't get to do it. And then when you know, like, I'm talking to you, do this. And I say, Mom, why are you shouting? I will go and do it. Honestly, that's the only time you will not get action done. And it's over to time. I found out that what works best for him is not the calm voice. I don't know, maybe I will get treatment today in terms of me not shouting, but I have found out over time that it's actually shouting that helped me to be able to get results as fast as possible. But Dr. Alalade is going to speak to us in the next few minutes about some early the protective factors in our environment. What are the protective factors for children in our environment, vis-a-vis the understanding that they seem to be exposed to quite a lot of things, especially with all that is going on. Now, the social media world is one thing. The drug world is another thing. Pornography and quite a whole lot of things that are there in our environment, and it's quite scary. No, it's quite scary. And what all that they have to confront with on a daily basis. Now, it doesn't look like education was hard when we were going to school, but now you find out that they're doing like 13, 14, 15 subjects, and then you're asking yourself, what's to what end? What's this? So what are the protective factors for children in our environment? Thank you so very much. Dr. Alalade, over to you.
All right, thank you so much for the question. I'd like to start by saying that a lot of things about the children stem from the home. If we look at it, I would like to first talk about a protective factor of a stable caregiving home. So a stable home does a lot for a child. When a child realizes that the home is stable, I have nurturing caregivers, I have parents that I can talk to, I have parents that I can interact with, it goes a long way in helping the child to talk about what is going on in their mind. Because like you said, we are in the digital age. The children are exposed to a lot of things. You never know what your child has been exposed to until they tell you. I usually give this example of a 13-year-old that the father had to bring for assessment because the child's tablet got spoiled, and the father had to take it for repairs. And by the time they got there for repairs, it was the man that was repairing the tablet that called the man and said, in the process of repairing this tablet, I saw that your child has been watching a lot of pornography. The father was in utter shock that this thing is what is happening. And it was in the course of interacting with the child, she spoke about how when she's browsing for her assignment, she just kept seeing the pop-ups to click, and she started clicking, and she enjoyed watching what she was seeing. So when there is a nurturing caregiving experience, a lot of times we are able to get the children to open up, to speak about what they are experiencing. Now, I would also talk about consistent rules and discipline. I know that Ms. X has already talked about this, but in relation to what Dr. Kemi has said, I believe that our environment has made us to believe that we need to shout at these children before they can listen to what we are saying. And over time, the children too have also gotten used to the fact that if my mother has not shouted, she does not mean what she's saying. If my dad has not raised up a cane, it does not mean what he's saying. It's the environment that has actually made us to be in that way. But of course, Ms. X, from what we are learning in the concept of behavioral analysis and behavior therapy, is that calmness, we need to get our children to get used to the concept of consistent rules and discipline. And I always tell parents that when you are laying down the rules, always remember that the rules should apply to you also. You cannot be saying that no phones at the dinner table, and then it is daddy that is picking up calls at the dinner table. So when there are consistent rules, when a child is living in an environment where things are consistent, it protects them from these psychosocial issues that can lead to them having behavioral disorders. The school environment also plays a very important role. It is important for parents to understand the school environment of the child. Like I mentioned earlier about modeling, some children would pick up some of these behaviors. A child could be going to a school where I've had an adolescent at our child and adolescent center. One of the things she said about her school, she just vehemently refused to go to school. It was during the in the process of evaluation that we realized that this adolescent believes that the school that she's going to tolerates a lot of unusual behaviors, a lot of defiance, and she could not cope, and that was why she was refusing to go to school. So a positive school environment can protect the child. A child who is exposed to bullying can decide to either be a bully or have negative emotional responses to the bullying. The child can be a bully or start becoming irritable, withdrawing to himself or herself. So the school environment is important. Open communication. We can never overemphasize the role of open communication between parents and the children. That is what enables it. You know, when a child is saying something, and a lot of times parents are listening to the child with the mind of, I want to correct. This child has done something wrong. When your child comes to you and says, Mommy, I want to tell you something, your antennas are sharpened that you want to correct. This child has done something wrong. But you know, a lot of times listening to what they have to say and then just listening to their explanation. Sometimes parents can cut in before the child has even finished talking. Meanwhile, the most important aspect of the conversation may even be the last thing that the child is about to say. But when you have already cut in, you have already started shouting, you did this, you did that. Before you know it, the child just keeps withdrawing back to himself or herself. Another important thing is opportunity for play and social interaction. Never ever forget that children would always be children. We should not expect that from morning to night. Let's say, for example, on a public holiday, you should not expect that from morning to night, the child should sit down in one place, be obeying all the instructions. So parents, children would always be children. So let's always create time for them to express themselves, for them to play. This helps them. This keeps their emotional and mental well-being in check. Because when the child knows that this is my time to play, so by the time father is saying that you cannot play now, the child is not seeing it as a punishment. The child is seeing it as this is the rule for the hour. And that protects the child from all of these defiant behaviors that may want to come up. Supportive family system, the community, our religious homes, the support that we are able to get from all of these centers also protect the child from some of these behavioral vices. And lastly, I would like to say that even when all of this is in check, if as parents we start noticing any of some of these warning signs that have been previously mentioned, early identification and intervention when problems arise is also very important to protect the child and prevent further degradation of whatever the child is experiencing. Thank you.
Thank you, Dr. Alalade. I would go with the calm voice today. I will give you a feedback. I would give you a feedback as to what it is. I hope I have not reinforced what it's not good. But you know, I hear her say open communication. And you know, one of the things that I feel till this morning, I said to my son, and I said, is there something you need to tell me? Just know that you have a safe space in mommy, and you can always, even if it is bad, I would always listen. I would not judge, because I understand now that quite a lot of them would most likely want to relate with their friends more, because my kids are even now moving from the childhood to the adolescent stage, and I've gotten to now understand that it's a different, completely different phase in itself. It comes with its own peculiarities, and you must be able to manage it as such. Thank you so very much, Dr. Alalade. She talked about supportive family, being there, helping all along the way. Now, Ms. X will be sharing with us some of the early or effective early intervention strategies that we can use to manage behavioral disorders in children? What are some of those things that we can do on ourselves to see how can we manage it? Over to you, Ms. Toby X.
Thank you, Dr. Femi.
Your
Just like
camera is
Dr.
turned over. Thank you. Yeah.
So just like Dr. Lalade mentioned, that early intervention plays a crucial role because when behavioral disorders are not addressed early, they worsen over time. So some effective intervention strategies include the following. One, early psychological assessment. So early professional assessment helps parents identify whether behavior is related to conditions like attention deficit hyperactivity disorder, autism spectrum disorder, anxiety disorder, learning difficulties, or maybe trauma. But one mistake parents make is that they wait until the behavior becomes very severe before seeking help. So another one is behavioral therapy. This helps children learn appropriate behaviors through reinforcement, structures, modeling, and consequences. So because there's a challenge, sometimes you might need to demonstrate exactly what you want them to exhibit, exactly the behavior you want them to exhibit. So the behavior is not to replace unhealthy, is not to encourage unhealthy behaviors, but to encourage them to keep exhibiting healthy behaviors with positive, functional, and communication skills. So parent training, parents need to be involved. Even some parents, when they now realize that, oh, this is a challenge, they find it difficult, they find it difficult to be fully involved. Why? Because some might come up and say, I don't have time, I've paid the therapist, I've done this, I've done that, but they also need to be involved. Why? Because when there's a collaborative effort on children with behavioral disorders, you see that there's a significant improvement. Also, there should be a structured routine. Children with behavioral disorders often function better when they can predict what's going on in their environment with clear schedules and all of that. Now, positive reinforcement. You also need to understand that consistently rewarding desired behaviors is usually more effective than just focusing on the punishment. Most times their excesses, we already know that their excesses is more than their strength. So, but when they make efforts to exhibit certain behaviors that are healthy, that you perceive as healthy, you encourage it, you reward it so that they can keep, exhibiting those behaviors. Also, school collaborations. Teachers, parents need to also collaborate with teachers, therapies, they need to work together. What do you observe? This is what I observe. You said I should do this. This is what so you can understand and maintain consistency across all settings. Thank you.
All right, thank you so very much, Ms. X. She had told us about some of the early interventions and the things that we can do as parents and all the things like that. But Dr. Lalade is going to talk to us, especially for individuals on this call today who have children or parents or school teachers, proprietors, who have kids who have behavioral disorders. And I would love that you, again, Dr. Lalade, just give a big recap of what behavioral disorders are. I know that quite a lot of people are just joining and they were not here when we started. I'll just give a big recap of what behavioral disorders are and so that they can know. And then you now link it up with how can we help them, especially when they look at, it looks like they're overwhelmed with quite a lot of things that is happening around them now. What to you, Dr. Lalade?
Yeah, thank you very much for the opportunity once again. It's been a good conversation so far. So I would go on to the concluding aspect by talking about what are behavioral disorders, particularly for those who joined in much later. So we're talking about repeated pattern of emotional and behavioral difficulties in children. And when we say emotional, we're talking about the way they express how they feel. And when we talk about behavior, we are looking at them doing what they are supposed to do as against what they are not supposed to do. So when we see a recurrent pattern of a child having unusual expression of these emotions, behavioral difficulties, that is now affecting the child's functioning in the school, in the home, and even in the community. And we also try to talk about the fact that it is normal for a typically developing child to express some behaviors that are not acceptable. Those are the ones that we call tantrums. We can say the child is stubborn, but we don't jump to term all of this as behavioral disorders. Because what makes a behavioral disorder is the severity, the frequency, and the fact that it happens in different settings, and then it's affecting the functioning of the child. So by looking at what can parents do, what are we telling our parents this afternoon? The first thing I would like to say is that having a child that has a behavioral difficulty does not mean that a parent has failed. That was why I mentioned when I was talking about the protective factors, that all of these protective factors may actually be there, and the child still comes down with some of these behavioral difficulties. But it is not an indication that a parent has failed. So don't look at yourself as a failed parent when you have to deal with a child who is having behavioral disorders. Even for the neurodevelopmental disorders that we have identified as one of the causes, I mean the autism spectrum disorder, the attention deficit hyperactivity disorder, having a child that has some of these disorders does not mean that one has failed as a parent. We should seek intervention early. When you have anything of concern, seek intervention early, because as we have said, many children improve significantly with early intervention and the right support. We do see a lot of improvement from early intervention. We should remember that the child's brain is still developing. So with guidance and consistency, positive change is still possible, irrespective of what you are seeing with the child. When you are able to guide, when you are consistent in your guidance, we are able to see positive improvement. So parents should be open. Understanding this concept of the brain still developing should make you open to doing all that you can do to help the child. Let's not suffer in silence. Seek professional help. We have our Child and Adolescent Mental Health Service Center. You should seek professional help. Support groups are available, particularly for parents of children who may have these neurodevelopmental disorders. And I always tell parents, take care of yourself. It is a parent who has a strong emotional well-being that is able to take care of a child with behavioral disorder. Caregiver burden is real. We see it every day in and out at the hospital, where a lot of caregivers, they come and they express the amount of burden that they are going through. So you need to be able to take care of yourself, because taking care of some of these children with behavioral difficulties can be emotionally challenging. It can be exhausting. So you also need to take time to take care of yourself. And we should know that parenting requires a great deal of patience and understanding. A lot of times, I'm still going back to this concept of patience and calmness. A lot of times, parents feel that we just need to shout, we just need to do all that we have to do. Sometimes just watching the child, this is something that I have practiced very well with my children. Just watching them and not saying anything. And when they come around, I say, just leave me. For now, I'm not your friend. You are not doing what I want. A lot of times I will just see them trying to do what I want them to do. But when you have made them gotten used to the fact that I must raise my cane, I must shout, the children will just get used to that. So parenting requires a lot of patience and understanding to help the child to reach their full potential. And that is the aim of every parent, for the child to be the best in whatever they do and to reach their maximum potential. And I know that as we keep learning, it's not nobody is the master of parenting. Nobody knows it all when it comes to parenting. But let's keep learning. Let's keep seeking professional help when we don't know what to do. It goes a great deal in helping us with everything we have to do. Thank you.
That's awesome. That's awesome, Dr. Alalade. That's awesome. That's awesome. Now, Ms. X will be talking to us about some tips to take home as parents, and then we will come back. There is a question that has been sent to me, Dr. Alalade, that when a child is having behavioral disorder, and then you had taken the child to the correctional facility, and then the child came back worse. What can you do? But we'll take that after we had taken Miss X now. Miss X, what are the 1, 2, 3 points that you can give parents? And if there are children here, what are those things that they can take home for away from all of these? Miss X, please. Please note, before Miss X comes up, please note that questions, comments could be sent to the chat box, and then our speakers would also attend to them. Miss X, over to you.
Thank you, Dr. Kenny. Yes, so some of the tips parents should take home is they should model the behavior they want their child to see. So children, according to Abba Bandura, it made us understand, in his story, it made us understand that children learn by observing and imitating other people's behavior. So if you want a child to exhibit healthy behavior, you have to also exhibit that behavior because they are watching. You can't give a rule and then you yourself, you are not following that rule. What they see, what you do is what they will exhibit, not what you have told them. So parents need to be very careful in guiding children with challenges like this. So also parents should avoid comparing their children because there's a challenge. They should avoid saying that, oh, she's better than you, is better than you, and all of that. So it does not encourage children with these challenges. It doesn't push them forward. It doesn't make them see themselves as someone that can still achieve certain things in life. But the child actually, what the child receives at that moment is that at that moment they are not good enough. And over time, this shapes how they see themselves. And so children don't need a rival. They need a mirror that shows that they are making their own progress and they can achieve certain things in life. So parents should also praise positive behavior more than they criticize negative behavior. Already, they should understand that there are challenges. They are not aware of the behaviors that they exhibit. So when they make effort to exhibit healthy ones, they should praise those behaviors and they should be consistent with their rules and expectations. Also, they should correct unhealthy behaviors early enough because before it becomes a pattern. So, and they should also listen. Children want to say a lot of things, but most times, most parents don't want to listen. So let them say all they want to listen. Create time. Ask them questions. Okay, you are back from school. What happened today and all of that. But when it comes to children like this, they have different ways of communicating. So parents should calmly listen to their children and know when and when to meet them at their own and help them solve their own difficulties. Thank you.
All right, thank you so much, Mix X, for that. One thing she said that resonates so much with me is the fact that children has a lot to say. Like I mentioned, I have a child who is bordering on becoming a teenager, and most times he would come and sit and he start pouring. And excuse you, it's the time I just came back and I'm tired. But one thing I have recognized in recent time is I must create time to listen. I must sit, I must hear him out. Otherwise, he looks for attention outside and they may not give him the same response that I would give him to be able to safeguard him. Thank you so very much, Ms. X, for that. Now, Dr. Alalade, I have a question for you. That how can you manage low frustration tolerance in children? This is also a factor that can cause behavioral issues in children. I know you spoke about the causes earlier. Somebody is asking, how can you manage low frustration tolerance in children? Dr. Alalade, over to you, ma'am.
Okay, thank you very much for the question. Even though I would have said that Dr. Kemi can even answer this question, because I mean, you just taught us this morning about self-efficacy and all of that, and we talked about this. So yeah, when we're talking about low frustration tolerance, we're saying that a child has difficulty coping with disappointment, coping with corrections, coping with situations that does not go in the way of the child. So when we have this instance, what do we do? There are actually specific techniques to teach emotional regulation. So we talk about making the child understand, sometimes what children do all of these things because that kind of child in our mind when I want this thing, this is how we should go. The child is someone that sees herself as, I don't want to disappoint my parents. I don't want any delay. If I write an exam, I must pass. If you give me 10 questions, I must get everything correctly. If I miss one, I just have to scatter everywhere, throw tantrum. So we need to teach the child that it's okay to have some disappointment. It's okay to have some delays. And we also talk about some of the techniques. For children, for adults, we talk about breathing techniques, but sometimes for children, we use the concept of counting for them because maybe it's much easier for them. So whenever you are experiencing something that you just want to bring out all of your shades because you are frustrated, why don't you take some time and count from 20 down to 1. So by the time the child starts counting, those are some of the techniques that could help the child. Another thing is we also need to identify if there are associated conditions. Some children are battling with learning difficulties, and that is why they are having this low frustration to tolerance, particularly when it is centered around the school environment. So we need to know that, in this present age, we have a lot of children with learning disorders, but a lot of children with undiagnosed learning disorders. And so when we also sometimes when the parents feel that there may be something else going on, seek professional help. Let's identify, is there really a diagnosis that we need to work on that can improve the child? And lastly, I will also talk about calm parenting. We can never overemphasize calm parenting. I'm sure people will be looking at her. This doctor and a psychologist should be calm. So yes, but honestly, calm parenting could actually help some of these children to be able to manage those frustrations. I hope I've been able to clear the question on the mind of the one person who asked.
Thank you, Dr. Lalade. There's another question, but before we come back to that, is the fact that this calm parenting, even me, I'm taking that away from here because I think it's quite very significant. We have reinforced a culture that shouts, and we have made people to know that they can only respond to shout. And that's why you get to some offices, workplaces, and other things like that. People communicate by shouting. And it tends to affect some other individuals' psychological functioning and well-being. So I think that is one of the major things that I am taking away from here. Yeah, somebody said calm or firm. Yes, calm and firm. Thank you so very much. Now, Dr. Lala, there's another question here. They said, the doctor made mention of academic stress. What's your take on this? Oh, sorry, another one is coming in. The doctor made a mention of academic stress. What's your take on this issue where a child of 4 years goes to school before 8 a.m. and comes home around 6 p.m.? Let me please prepare to take the next questions after that. Dr. Lalade, over to you, ma'am.
All right, thank you very much. So I think that a child going to school before 8 a.m. and coming back from school at 6 p.m., I want to understand two things. First is that the parent has to go to work. We never tell parents not to go to work. If the parent is not going to work, how would the child feed? How would the child get all of the things that the child needs to get? So we never tell parents not to go to work. But I also want to understand that 8 a.m. to 6 p.m. is looking at, is not that the child, there is after school in that mix. So the point of academic stress is the child is experiencing challenges from the things that are related to learning. So in after school, we are not expecting a child to still go to after school and they are still teaching. After school is meant for play. Like I've said earlier, allow children to play. We don't prevent children from playing. That play is an important aspect of the development of the child. Very, very important aspect. It improves social interaction. It improves their thinking. It helps them to be creative when they have things around to play with. So if it is not from 8 a.m. to 6 p.m. that the child is learning is academic work, that may not predispose the child to academic stress. If there are times of playing between maybe from 2 to even 6 p.m., it's interaction with the other with other children, their age group, the people that are older or people that are even younger, that may not really put too much academic stress on the child. As much as it is not also a center whereby from that 2 to 6 p.m., all they are doing is they are watching the TV. As long as that is not it. But what we are talking about in terms of academic stress is when the focus is what the child is learning, not the duration that the child is staying in school. I hope that helps. Thank you.
Thank you so very much. We have lots of questions coming in. Ms. X, how can we help a child who, instead of greeting, now says meh, and the mother does not see anything wrong in that? Is there something the parents can do about that, or people around can do? Quickly over to you, Ms. X.
Thank you very much, Dr. Kemi. Now, to address this, a child should understand that unhealthy behaviors shouldn't be encouraged. So the mother should make the child understand that unhealthy behaviors shouldn't be encouraged. Now, for that kind of behavior, if it happens over time, the child tends to also portray the same behavior to the mother. And at some point, she becomes very irritating and start punishing the child unnecessarily. So at that point, the mother is made to understand that this is unhealthy, and so the child should stop doing it. I don't know if that answered questions.
I think it does. The mother should be educated. That's what you had said. Because until the mother is educated, she can't help the child. So education of the mother is quite important. Thank you. There's a question for Toby Davids, who said, thank you for your insight on all of this. But how do clinicians mitigate the issue of misdiagnosis and overdiagnosis in clinical practice, which is more reliable and accurate over time, especially the diagnosis of ADHD in children? Then, Dr. Lalade, I want you to be able to quickly take that in relation to sibling rivalries. How do we manage that? Over to you. Our time is running very fast today. Dr. Lalade.
Okay, you're actually also running very fast, and I'm trying to keep up with the question that you were reading. Okay, so but let me
mitigate the issue of misdiagnosis and overdiagnosis in clinical practice, especially when it comes to everybody seems to have ADHD all of a sudden now. Okay, so how do we do then? Sibling rivalry. Oh, yes, ma'am.
Yes, so in terms of diagnosis, we should always make sure that we get the right setting for the diagnosis. The truth is that because we are now in the era of AI, I recently had a child that I was even speaking to Miss X about the child. So the mother brought the child. She had read a lot of things online. All of the things that you see in ADHD, the exact terminologies that were used by our manuals was what the mother came and she was reading to me. But by the time I interacted with the child, we did assessments for the child. We discovered that this child actually had intellectual disability and it was not ADHD. So I think that this misdiagnosis and overdiagnosis can come from when someone is not really experienced in making some of these diagnoses. Having the understanding and the experience in making diagnosis is what is going to go a long way in helping. And child and adolescent mental health is a highly multidisciplinary work. There are times that when the psychiatrists are saying we come on board with the psychologists, we work together, even including the occupational therapists, the speech therapists, and the educationists. It's highly multidisciplinary. So we are able to put heads together to really know what we are dealing with for the child. So that could help by getting the right place for assessment, could help to prevent misdiagnosis or overdiagnosis. So, and then in terms of sibling rivalry, it's like we have, like Ms. X had mentioned, there are actually techniques to teach a lot of all these things. Children should be made to understand, and then modeling. And when things have been done, positive reinforcement, when the sharing between siblings have happened, we should reinforce the positive side, and the ones that they have not done well, we should make them realize that they have not done it well, and they should be taught. Children, like I mentioned, their brain is developing. So when you teach them, children are open to learning. They just need to be told what to do. If we don't tell them what to do, they will pick up whatever they think is right and they will do it. So it's important to always tell them what they're expected to do in different circumstances. I hope that helps.
Thank you so very much, Dr. Olalade. Miss X, at what age should we start teaching our children about sex education?
Okay, thank you very much, Dr. Kemi. Early enough, as early as 8, you start by making them understand that you don't touch the opposite sex, even your the same sex inappropriately. So you don't address anyone as uncle. When somebody comes to the house and try to um try to act like they are their family members and try to give you something or try to make you feel comfortable sitting on their lap and all of that. You teach your children not to do that as early as possible. You start teaching them bit by bit till when they are till when they can understand that till when they can understand that it is not appropriate.
Okay, thank you so much, Miss X. I know that Toby mentioned 8 because we feel that at that level, the level of intellectual functioning is high, but there are age-appropriate things that we can start from as early as 2, to help them to be able to understand some of things. Now, we have so many things online where you can teach body safety and rhythms and songs that align with my private part, my body part, it's my own, don't touch it, among other things. Like that. Dr. Badru, thank you for the tips that you have helped us to write out. Oluwatoyin Ogukom, me, thank you so very much for echoing the fact that we cannot train our children by shouting and all the things like that. Sex education has been attended to. Okay, Dr. Alalade, they said, Doctor, how can one manage an 11-year-old boy who consistently engage in deviant behavior in school, like stealing, vaping, lies, poor toiletry? The parents are tired of him and then they want to send him back to Nigeria. They're actually based in UK. They are not expected to punish him out there. How can one help such a child? Over to you, Dr. Lalade, 1 minute, please.
All right, thank you. So the first thing is let's get a diagnostic assessment for this child, because there are some developmental disorders that could, behavioral disorders that could make a child to have some of these things. Particularly, we could talk about oppositional defiant disorder or conduct disorder, which our environment have turned them into social concepts, but they are actually real diagnoses that a child or an adolescent could be struggling with. So let's get a diagnostic assessment for the child. When we have a diagnosis assessment and we know what we are dealing with in the child, the child could actually also be responding to things in the environment that he or she does not like. So when we are able to explore all of these things, we are able to determine what to do, how to take care of this child. Some of these children may also be having mood disorders. When a child is having depression, it's not the child that would, children and adolescents can also have depression. And when they have depression, they will not be the one that they'll be keeping to themselves, be crying. That is not the usual thing you would see in children and adolescents. Rather, you could see irritability and some of these defiant behaviors. So that's why it's always important to get a diagnostic assessment. Let's know what we are dealing with, and we would not be able to correct. Some children may require behavioral therapy sessions that would help them to overcome that. Some may even require medications at some point. So it's important to get a diagnostic assessment. Thank you.
All right, thank you so very much, Dr. Alalade. God's Power sent in a question to say, thank you, Dr. Alalade. I understand that the upbringing in our country, Nigeria, is different from US and other things like that. The school hours students spend in school is too much in Nigeria. And this person is seeing a difference between what happens in the United States and what happens in Nigeria. And I quite agree with God's Power. Thank you so very much for sending that in, Onoka, who is a retired mental health nurse from Arrow. Thank you so very much. Christabel, Charity, thank you. Anyo, I'm sorry, I can't pronounce this name very well. Anya Abe. I'm sorry if I murdered it. I'm sorry. When my son was about 2 years, I had to go to school, and my husband delayed coming, and I locked him. Maybe I locked him inside crying. Today, as an adult, he's an XUD, and I feel it's because of my neglect. And now that's Dr. Lala, just one word: encourage the spirit. Just encourage the spirit. One word to encourage the spirit.
Yeah, thank you. So, like I have said, having a child with behavioral difficulty does not always mean that we have failed as a parent. Don't always look at it and say that. If somebody is asking what is SUD, I want to believe the person is talking about substance use disorder, that this child is using substances. So a lot of times, many of these things, like I said, it's an interplay. The environment plays a lot of role apart from the nature of the child. So having someone who is doing all of this does not mean that the person has failed as a parent. But what I would also like to add is that you can always seek intervention. Interventions are available even for people who have difficulties with addiction. Thank you for being a parent, and God will continue to help you.
All right, thank you. Thank you, Dr. Lala. The recording will be on the YouTube page of the Yabo Voice, FMPHY, Yabo Voice, FMPHY, one word. You would get the recording of this episode as well as the previous episode. How can one help or manage a stubbornness in 2-year-old, 5 months old girl? Tell one, shut up and climb window and Dr. Lala, one word, one word. How can we help that child who is very stubborn?
Okay,
2 year, 5.
in one word, modeling. Modeling. Age 2 is the age to show the children what is right. Between the age of children less than age 4, what our focus is showing them what is right. So if I'm going to, because of time, I would say modeling. Let's model the right thing for the child. The child will have picked up that shut up from somewhere. Absolutely. So let's model the right behavior for the child. Thank you.
Thank you so very much. Kingsley said, yes, we shout and scream, but there is a need for behavioral re-engineering by unlearning and relearning how to become firm. Thank you so very much. Charity says, I also feel that a child may not be able to be diagnosed properly for autism until the age of, now Dr. Lalade is especially there. I want to argue with you. Jeff is saying there's so much misdiagnosis out there. Oluwatoyi is saying, yes, the question to sexual education as early as a child can talk and understand. Yes, I agree with you. Age-appropriate sex education is key from when the child understands simple communication. James is saying, is it proper as an adult parent to watch the private parts of a baby after age 3? Have you trained that child to be able to do it themselves effectively? And that's where training is very important. When you train effectively till they're about 5 years old, then they can handle it on their own, and then they'll be able to move on. But just ensure that you're able to model it for them as much as possible. SUD, substance use disorder, that has been answered. Thank you so very much, everyone, for being on this call. Today's webinar has been really, really interesting. We really don't have the luxury of time, but I know that there are take homes that we all will be taking away from here. Dr. Badru, thank you for also highlighting some of this point for us. Like I said, the recording of this webinar as well as the previous episodes will be on the YouTube page of Yabo Voice FMPHY. Then you'll be able to access this recording as well as the previous episode. Next month, by the grace of God, we're looking at substance use issue. And you would agree with me that that is a big problem in our community. I do not know how many people saw the video of a police officer who was under the influence of substance, and he was there and people were watching him and every other thing like that. Now that is a whole lot, and we need to be able to talk about this thing because it's no longer in the slum. It's now in the posh areas. It's in the churches. It's in the schools. It's everywhere. And that's what we're going to be talking about next month by the grace of God. Now we'll have erudite scholars who will be coming in and sharing their own thoughts with us. Now the Dean of Nursing, food too okay. I'm not sure. Well done to all the presenters and important that needs attention, bullying, among other things like that. Thank you so very much for pointing that out. I want to say on behalf of the medical director, Dr. Lubenga Dekile Owoye, and the members of the Yabo Voice team and everyone who had been here, thank you so very much for finding out time to join us. The number here today is quite significant. We had over 150. Thank you so much. We will come your way next month by the grace of God. I will be looking at substance use issues in our community, in our lives, and everything, and how to mitigate against it. Until we come your way again, please ensure that you stay healthy, take care of yourself. If you have a child who is not functioning as you would want it to, then please reach out to us. Now, in Yaba Voice is like the online arm of the community outreach of the Federal Neuropsychiatric Hospital. The hospital is at Yaba, the Federal Neuropsychiatric Hospital. You can reach out to us. We have a child and adolescent unit. Dr. Alalade is part of the people there, and then they would be able to help you. So thank you so very much, everyone, once again, for being on this call with us. Until we come your way again next month, please stay safe and take care of your mental health. Remember, there is no health without mental health. Bye-bye.